Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week for part 2 of insulin resistance or metabolic syndrome. Last week we started the year off with a little bit of house cleaning. I went over with you guys the fact that I had a leaky roof in my utility room over Christmas break with my as I was home with my family. The insurance agent came over and basically wrote me a check for what damage he could see. And I shared with you that it's an illustration very similar to our healthcare system. We treat or only look at the things that we could see, whereas this show is designed to really, to unlatch the hood and look under the hood of the car. Let's get into the motor and the gears and actually see what's broken. Because like I said to my insurance agent, I don't know. How do you know that the water hasn't penetrated through the walls or has leaked down into the basement just because it hasn't come through the walls yet? And he said we could only assess what we could see. Let's use that as an illustration that as we look at our healthcare, and you guys have your health journals and you're writing things down this year and you're embarking on a wellness lifestyle, that we're interested, yes, in the things that we could see. It's very important to observe our skin and our eyes and our bodies. That's what doctors do, and we should be doing those things as well. But always understanding that inside out is how we heal, and our health comes from inside out. And insulin resistant to metabolic syndrome is a disorder, which is the pre-diabetic disorder, pre-type 2 diabetes disorder, that we started to take apart last week, that we really don't want to just be like the insurance company looking at what's visibly the problem. We want to get into the motor. We want to lift the hood up, get into that car, and get under the hood, if you will, of the problems, the underlying disorders that are driving the chronic illness in our country. Luke 1:37, for with God, nothing is impossible. Metabolic syndrome is exactly like that. It is 100% reversible. And if we take the action steps, we could reverse this pre-diabetic state, which millions of Americans are suffering from. And I shared with you last week that my Wellness at Work program will be taking on 15 churches this year. I will do a 90-minute free public speaking program for the first 15 churches that welcome me into their church or their church organization. This is the first year I'm doing something like this. I'm taking By Design basically on the road. So if you're part of a church or a group and you'd like to hear this message live, I welcome the opportunity, and you could contact us through info@naturalhc.com. That's info@naturalhc.com. That's an email address that goes to our community relations department, and we'll be happy to touch base with you about your church. So let's go over what we started with last week, which was this condition called insulin resistance, or it's called metabolic syndrome. It's also called Syndrome X. But the title, one of the titles of this that I like the most is called weight loss resistance. Why can't people lose weight? If it's as simple as calories in, calories out, why is it that if we restrict calories, people do not lose weight? Well, there is a lot going on under the hood, and we have to get under the hood of this condition to really figure it out. So stay with me here, and we're going to go through what we went over last week. Remember, I gave you a laundry list of things. You could go to a browser and you could look up metabolic syndrome. If you have 3 or more of a list of things, you then would be considered as pre-diabetic, such as a fasting glucose greater than 100, fasting insulin greater than 15, your hemoglobin A1C greater than 5.5, triglycerides greater than 150, your HDLs less than 50 in women and less than 40 in a male, Waist circumference, greater than 35 in a woman or greater than 40 in a man. So yes, most of this is blood analysis. So I shared with you, I want everyone to go to their GPs. If you haven't had a recent blood test, get a comprehensive blood test. And you want to look at these numbers with an objective eye, looking at some of the questions that we asked last week as well, like is there a family history of obesity? Do you sleep 7 hours or less a night? Do you suspect or have been diagnosed with food allergies? Are you exercising ineffectively? Meaning, is it just not working? Bad habits. Have you failed on 3 or more diets? Are you depressed? Are you stressed out? So there's a number of things that are contributing to this pre-diabetic state. And as we get into insulin resistance, here we are now. Let's say we find ourselves in this insulin resistant state. What does that mean? What is insulin resistance? Well, it occurs when your body stops responding to insulin. Now, insulin is a hormone made by your pancreas. So insulin resistance is a pre-diabetic state, and if it's not corrected, will likely lead to type 2 diabetes. And it's very common. The rates of insulin resistance continue to rise, including in adults and in children. It's estimated that about 1/3 of Americans are insulin resistant. So it is bad for our health. It increases our risk of heart disease, stroke, and increased risk of death because type 2 diabetes and insulin and sugar problems in the body lead one down a road of having higher amounts of cardiovascular disease. So insulin is a hormone, like I said, that is made by your pancreas. And what it does, it basically takes sugar out of your blood and puts it into your cells. So you eat carbohydrates. Carbohydrates are sugar. It's converted to glucose. Glucose is now circulating around your bloodstream. Too much glucose in your bloodstream is very, very dangerous. So this insulin packages the glucose molecule, pulls it out of the bloodstream, and sticks it into one of your cells. Although, insulin is often thought of as a bad guy, it's very important to realize that you would die without insulin. Okay? So insulin is critically important. After you eat something like a carbohydrate, these foods are digested and they're created into sugars and they enter your bloodstream. And then your body, by design, automatically responds with elevating its insulin levels. So now all foods will cause a rise in insulin levels, but carbohydrates rise them more than proteins or fats, which is why we're usually focusing on carbohydrates when we discuss insulin resistance. So insulin takes the sugars, brings them into the cells of your body, let's say, for example, a muscle cell, and it unlocks the door to the cell and escorts the sugar inside and thus out of the bloodstream. Without insulin, blood sugar levels would remain very high, which damages your health. So a fasting blood sugar of 100 or more. Now, type 2 diabetes is generally considered when your fasting blood sugar goes above 125. This is pre-diabetes. So normally a person who has 100, 102, 104 fasting blood sugar, not a whole lot is done for it. And I say, no. I say, wait a minute. A fasting blood sugar of greater than 100, I want to intervene now. I don't want that blood sugar going to 120, 125, 130. So let's get back to this. This insulin resistance occurs because of poor lifestyle choices. Why does our blood sugar go up on a fasting blood report? Well, obviously, there's something wrong with the way the insulin is packaging the sugar molecule and getting it out of the bloodstream. And what causes that? Overconsumption of bad foods, particularly low-quality carbohydrates, sugary foods, lack of exercise. Okay, these are the primary culprits of this condition. And as a result, your body begins to ignore the signaling, the insulin's messaging. So in other words, insulin and is sent out, the cell ignores the insulin, you see, so the sugar remains in the bloodstream. So we've got metabolic damage here, folks. Your lifestyle choices, which have caused metabolic damage to the way sugar and insulin are supposed to work by design, the way God designed us to work, our lifestyles have caused this lack of communication between sugar and insulin. Okay, so let's keep going. What happens? This insulin resistance, what happens? Why do we become overweight? Well, in the vast majority of cases of insulin resistance, we end up with people being overweight or obese. The fatter we get, the less our bodies will respond to insulin. As we become more and more insulin resistant, that's why the name of this disorder is insulin resistance, we store even more body fat. So more body fat is stored as a result of this metabolic dysfunction, where under the hood of the car, the oil is getting clogged in the gears. It's not working the way it should. We're not a highly tuned Ferrari. We're on our way to be a broken down car that's rusting out in the rain. So this vicious cycle is set up between fat gain and increased insulin resistance. We're set up in this vicious cycle of eating bad foods and carbohydrates, which are leading the body down this road of insulin resistance. So Syndrome X was first, named in 1988 because what researchers did, they said, well, let's group symptoms together like I shared with you. Symptoms such as excessive fat around the midsection, high cholesterol, high triglycerides, blood pressure, and of course, insulin and blood sugar problems. And so what it turns out is Syndrome X was actually named a syndrome in 1988 because researchers started to see the correlation between a number of things like I've described to you and how they set us up for becoming type 2 diabetic. So again, how do we know if we're insulin resistant? We want to get blood work done. We want to check fasting insulin. We want to check fasting glucose like I shared with you. We want to check that hemoglobin A1C, triglycerides, and I've gone over that with you. And it's very, very important that we look at that. Now, just by looking at yourself in the mirror is an interesting way to look at your body type because there are some physical signs of insulin resistance. So let's go and observe. The most obvious sign is too much fat around the midsection, and we call this an apple appearance. The body starts to take a form of looking like an apple shape. And it basically, there's the waistline measurements like I went over with you, which indicate that a woman greater than 35, a man greater than 40, we're going to have an increased midsection, and that could be something that a very easy way to say, hey, that is a tell sign that we're insulin resistant because the body fat will attack our midsection. And just on another side note, skin tags have also been correlated with insulin resistance. So that's something you may want to talk to your dermatologist about if you're dealing with an excessive amount of skin tags. So what do you do? Now, here you are. Now, maybe you're sitting there right now in your car or your house and you're listening to me talk here and you're saying, I really think I might have this. Well, you want to get it diagnosed by a healthcare professional. As much as this information is important, and I want to turn you on to this fact, and I know you have your health journal out and you're making notes, you want to get it diagnosed. This diagnosis should include a very thorough history of the way you eat, the way you exercise, your family history, a physical exam. It should include blood values, and it should be monitoring your blood values as you embark on a wellness lifestyle. Many times we order saliva testing because I want to know what the cortisol values are in my patients who are dealing with stress, because stress in of itself is a major contributor to insulin resistance. And if you go back to some of the earlier shows on stress, you know how cortisol is a hormone made by your adrenal gland that has a direct impact on our metabolic machinery. So we're dealing with metabolic machinery here, and saliva testing along with blood testing is typically recommended in these cases. And in most of the times when we treat insulin resistance, metabolic syndrome, it comes down to lifestyle modification. This includes diet and nutrition, the appropriate type of exercise for you, the individual, and there are specific recommendations and attention paid to things such as carbohydrates, proteins, and fat intake. Certain supplements could also be very beneficial in helping to package the insulin, the sugar by the insulin. We want to wake the insulin sugar communication back up. We don't want to just be looking at this like my house and what you could see with the water leaking through. We want to rip the walls down and get into what's behind. What's the real damage to the metabolic machinery? We're taking the hood and we're getting under the hood of the car. Okay, guys? So next week, what I'm going to do is I'm going to get into the nutrition and exercise habits that we use in our office when we diagnose someone with prediabetes or insulin resistance and what we could do about it. Please remember to go to drproodian.com. This is my blog site. All of my blogs, I blog every Wednesday, are there. Feel free to go back. I have blogged on insulin resistance, and you could put that into the little search bar and check it out. Have a blessed week. You've been listening to the By Design radio program with me, Dr. James Proodian. If you'd like more information about me, please go to Proodian Healthcare. It's Proodian healthcare.com, and feel free to submit any questions. Be well, and God bless you.